My name is Allison Watson and I represent ring chromosome 20 syndrome, which is an ultra-rare epilepsy disorder of which there are only 150 cases documented in medical literature worldwide. I'm an ePAG advocate for epicare-ERN. epicare is the European reference network for rare and complex epilepsies. The patient community for rare and complex epilepsies have a number of different needs. As you may or may not be aware, epilepsy is one of the most common neurological disorders. So many people would ask why epilepsy is considered a rare disease. In fact, there are 130 different rare and complex epilepsies defined currently, and they encompass genetic epilepsies, structural abnormalities, metabolic epilepsies, infantile disorders and more. These different epilepsies have very different underlying causes, and therefore they all share in a common symptom of seizures, but the seizures themselves manifest in many different forms and are also typically associated with various other comorbidities or difficulties that the individual patient has to manage through their lifetime. None of these epilepsies typically respond to any of the traditional treatments. Therefore, the differential diagnosis require differential treatments and care and management, and therefore in each case each of those 130 epilepsies should be recognised as individual rare diseases in their own right. Working as an ePAG advocate is a new partnership working with doctors and other healthcare professionals. One of the challenges is learning to negotiate this new relationship from both sides and working together to a common goal. We've been working on this for the last 2.5 years, and I would say in the last 6 months we've managed to achieve some significant successes in moving forward in our partnerships. Examples of this would be where ePAG initiatives that we have suggested ourselves that we believe would be of benefit to the patient community, such as education and raising awareness through production of leaflets on individual diseases and webinars. These ideas have been accepted and indeed included in the objectives of the epicare-ERN, and now we are working together with the doctors to produce these outputs. Furthermore, ePAGs are now being more actively engaged in each of the work packages, the various epicare activities that they are undertaking, which from the very beginning of the ERN were very much dominated and steered by the doctors themselves. There is now very much an acknowledgement that the patient perspective should also be included within that journey, and therefore the overall perspective and holistic approach to benefits for patients and patient families is being considered.